Hello and welcome back. Today, we are diving into an increasingly common condition that affects millions of people globally fatty liver disease. If you or someone close to you has been diagnosed with fat accumulation in the liver, this video will guide you through what it really means, why it happens, and most importantly, what steps you can take to manage or even reverse it. Fatty liver disease occurs when excess fat builds up in the liver cells. Normally, the liver contains a small amount of fat, but when fat makes up more than 5 to 10% of the liver's weight, it is considered a fatty liver. It is a silent condition in many cases, often discovered incidentally during routine blood work or imaging. There are two main types. First one is the non-alcoholic fatty liver disease. Occurs in people who drink little to no alcohol. This is the most common form, especially in developed countries. Second one is the alcoholic fatty liver disease. It is caused by heavy alcohol consumption over time. Non-alcoholic fatty liver disease can further progress into non-alcoholic steatohepatitis, which is a more severe form involving liver inflammation and damage. Fatty liver is strongly linked to obesity, type 2 diabetes, high cholesterol and triglycerides, metabolic syndrome, poor diet, high in sugar and refined carbs, sedentary lifestyle, rapid weight loss or malnutrition, and excess alcohol use. In early stages, fatty liver disease usually has no symptoms, but as it progresses, individuals may notice fatigue, discomfort or pain in the upper right abdomen, unexplained weight loss, weakness, confusion or memory issues in advanced liver disease. Fatty liver disease is often silent in its early stages, which is why diagnosis relies on a combination of clinical evaluation and test. Here is how it is typically identified. Blood test. Elevated liver enzymes, particularly ALT and AST, are often the first clue. These enzymes indicate the liver cell injury, even in the absence of symptoms. Other blood markers like GGT and ALP may also be checked. Imaging studies. A liver ultrasound is usually the first line imaging test. It's non invasive, widely available, and can detect increased liver echogenicity, a sign of fat accumulation. However, it may not detect mild steatosis. If more detail is needed, doctors may order a CT scan or MRI, which can provide better visualization of fat content and liver structure. Next is the fibroscan or transient elastography. This is a specialized type of ultrasound that measures liver stiffness and fat content. It helps assess the degree of fibrosis and steatosis, which are critical in evaluating disease progression. Next is the liver biopsy. Although rarely needed, a liver biopsy is the gold standard for diagnosing non-alcoholic steatohepatitis and assessing fibrosis severity. It involves extracting a small tissue sample to check for inflammation, fat, and scarring under a microscope. Biopsy is usually reserved for unclear cases or when advanced disease is suspected. Early diagnosis is crucial. Catching fatty liver disease before it progresses to inflammation or fibrosis significantly improves the chances of reversing it. Fatty liver progresses in four stages. First one is the simple steatosis, and the second one is the non-alcoholic steatohepatitis. Third one is the fibrosis or scarring of the liver, and the fourth one is the cirrhosis. In this stage, the liver is permanently damaged. Only a small percentage of people with non-alcoholic fatty liver disease progress to cirrhosis, but the risk is higher in people with diabetes or obesity. If left untreated, fatty liver can lead to liver fibrosis and cirrhosis, liver failure, liver cancer, and cardiovascular disease, the leading cause of death in people with non-alcoholic fatty liver disease. Although there is no single approved medication that can cure fatty liver disease entirely, the good news is that it is highly manageable and in many cases even reversible with the right steps. Treatment focuses on reducing liver fat, inflammation, and preventing progression to more serious liver conditions. Here is how it can be effectively managed. Weight loss. Losing just 7 to 10% of your body weight can significantly reduce liver fat and even reverse early stage liver damage. It is the most effective strategy for managing both non alcoholic fatty liver disease and non alcoholic steatohepatitis. Regular exercise. Aim for at least 150 minutes of moderate intensity aerobic activity per week. Exercise helps reduce liver fat even without weight loss and improve insulin sensitivity. it's important to manage underlying issues that often accompany fatty liver disease. Keep blood sugar under control if you have diabetes or prediabetes. Manage cholesterol and triglyceride levels with diet or medication if needed. Keep blood pressure within the normal range. These steps help reduce inflammation and slow disease progression. Avoid alcohol. Even small amounts of alcohol can worsen liver damage in those with fatty liver. It's best to avoid alcohol completely. While there is no universal drug approved specifically for fatty liver, certain medications are sometimes prescribed. Vitamin E in non-diabetic patients with confirmed non-alcoholic steatohepatitis. It has antioxidant properties and may reduce liver inflammation and fat buildup. Pioglitazone, a diabetes medication, this may benefit patients with non-alcoholic steatohepatitis, especially those with diabetes or insulin resistance. Other agents like GLP-1 receptor agonist and SGLT2 inhibitors are also being explored in clinical settings and may be used under specialist supervision. Regular follow-ups with your doctor are important to monitor liver enzyme levels, track weight and metabolic markers, and adjust treatment plans as needed. Specific diet tips include avoid sugary beverages and processed foods, choose lean proteins like fish and legumes, use olive oil instead of saturated fats, eat plenty of fiber-rich foods, and limit red meats and trans fats. Even if weight loss is modest, regular physical activity helps improve insulin sensitivity and reduce liver inflammation. Examples include brisk walking, cycling, swimming, yoga, or Pilates. To prevent fatty liver disease, maintain a healthy weight, eat a balanced diet and nutrient rich diet, stay physically active, limit alcohol intake, and get regular health checkups if you have risk factors. Monitoring is essential. Your doctor may recommend regular liver function test, follow-up imaging, assessment of fibrosis progression with fibroscan, regular screening for complications. Consult your healthcare provider if you have unexplained fatigue or abdominal discomfort, overweight, or have metabolic syndrome, have persistently abnormal liver enzymes, and concerned about alcohol use or diet. Living well with fatty liver involves staying informed, committing to lifestyle changes, regular doctor visit, and seeking support from family or health coaches. To sum it up, fatty liver disease is a growing global concern, but it is also manageable, and in many cases, it's reversible. Understanding your risk, making a healthier choices, and staying consistent with follow-ups can make all the differences. If you found this video helpful, please give it a like, share it with your friends, and subscribe to the channel for more evidence-based health content. Stay healthy, stay informed. I will see you in the next lesson.